health and a little wealth and a lot of love.
Yeah, it's not easy because sometimes it feels like there's some gray area. Technically, you're supposed to double charge someone if they come in for a preventative visit, like a physical, and they also want to talk about concerns.
Like, how do you stop that though? So if someone can be honest, I come in there for physical and I say, hey, I have this issue. I want to talk to you about it. You know, I don't know how I feel if my primary care doctor would like, because a physical doesn't cost anything through insurance, but they talked about that and then I have a copay afterwards. Talk to me about that. That's just weird.
Yeah,
And the doctor's like responsible for that? Almost feels like a conflict of interest. I don't know. It's weird.
yeah, it can be hard because it's a double-edged sword. You can't really pick and choose who you're going to double charge and who you're not going to double charge. And then, you know, you're, I guess, technically being fraudulent if you don't charge someone by when you're talking about several, you know, chronic conditions or other health problems during their physicals, because, you know, insurance only wants to pay for a certain thing. So it's all a mess.
Yeah.
The whole system is a mess.
Yeah. I wouldn't say every single system is this way, but I guarantee you that people don't know that. When you have an annual physical and then you have other medical problems and you want to bundle those together, I guarantee you people just don't know that. So what advice would you give people who are going for an annual physical but also have medical issues? To me, an annual physical is, yeah, you do that, but you should have a conversation with your doctor to check up on health.
Yeah, I mean, I don't think there's a right answer. Some people don't mind being double billed if their insurance is, you know, if they're just paying a minimal copay. But if it's someone who's living paycheck to paycheck and they don't have very high insurance coverage, then it might be a significant financial burden on someone. So I think just being familiar with your health benefits can be really helpful. Going into things, kind of knowing what you want to talk about and what's covered and what's not covered. But I think there's also this new system called value-based care, where it's, you know, it's more based on the outcomes of the patient and their numbers, and not necessarily a fee-for-service kind of model that might gain some traction and might be beneficial in the long run.
Like value care. So what does that mean? Like people are incentivized to have better scores on their health?
So
and the insurance goes down? Like what is that? I don't know what that means.
You're able to I guess, spend more time and effort on patients, especially those with high complexity that have a lot of health problems, to keep them out of the hospital. They'll reimburse you more to keep those people out of the hospital or out of the emergency room, instead of seeing more patients, because, you know, hospital fees and emergency room fees are very costly, especially for, you know, for the patient or insurance company.
Absolutely.
With a little health and a little wealth and a lot of love, that's a life that we live. Susan Scruggs.